Hi, I'm Dr. Mark Pederson. I'd like to welcome you to our clinic, Family Chiropractic. We're going to do a little walk through the office, give you a tour of the different therapies that we use in the office. So when you come in to the clinic, you'll come up to the front desk and you'll see Jolene sitting here. You've probably spoken with her on the phone already when you've made your appointment. And she will greet you, take any paperwork that you have filled out, and then she'll direct you to the next stop in the clinic. We have our transition area here. Down one side of the clinic we do a lot of our therapies, and on the other side of the clinic is where we adjust the patients and do all of our nutrition work. So let's take a walk down the therapy side first. As we come down the hall in room 1, we do a therapy called neurofeedback. Neurofeedback is essentially brain training. We work with conditions of anxiety, depression, ADD, ADHD. With neurofeedback therapy, it's a method of retraining the brain to fire in a specific pattern. What that means is, if the brain is firing in an unhealthy pattern, we can exercise it and strengthen it in its weak area. With the neurofeedback technology, over here is an example of in real time where the technology is reading the brain waves. And as we're watching the video, the patient will watch, and when we're getting a healthy pattern, the video will stay nice and bright and the sound will stay nice and full. If the brain starts to revert to that old unhealthy pattern of brain firing, the movie will start to dim down and the audio will go soft. And the brain naturally wants that reward. It wants to see the picture and hear the sound. So it will switch back towards that healthier pattern that we're trying to train it in, and the reward will be there. The video will come up nice and bright and the sound will come nice and full. So we're in room 2. Room 2 is our therapy room that we have pulsed magnetic therapy in. This is my favorite therapy in the clinic. We have 2 pulsed magnetic therapy units. It's the most advanced pulsed magnetic frequency therapy unit on the market. The in and out of pulsed magnetic therapy is that it increases cellular respiration. That means it increases the cell's ability to take in nutrients, to make energy out of, and to eliminate those metabolic byproducts, those toxins. And if you can do that, you essentially have more energy for your body to repair and recover with. In this therapy room, we do a number of soft tissue techniques. Grafton is a soft tissue instrument assisted technique. So we take these different shaped instruments and we can work through the muscles, ligaments, and tendons to release adhesions that are deep in the muscle. The next technique I'd like to talk about is a medical device called rapid release therapy. The treatment head on this device is about the diameter of a quarter, and it travels up and down 167 times per second, so extremely fast. What happens when you have that on the tissue is that it creates a little bit of a ripple effect. We have ultrasound, ultrasonic waves that transmit out of the head, so as we're working over a muscle, those sound waves go into the muscle and they vibrate it and heat it up. So it's a deep heating therapy. Works great for loosening muscles as well. In room 4 we do our laser therapy. Laser is fantastic for reducing inflammation that's deep in the body. With laser we can penetrate into a painful swollen joint to move the inflammation out. The difficult part is getting deep enough penetration without creating surface heat. So we use a laser called the MR4 super pulsed laser. This is part of our alternative work in which we help patients detoxify. This is called cell cleanse therapy. And when the patient is undergoing cell cleanse therapy, they would have a seat comfortably. Their feet would be in a nice warm water bath. And in that warm water is this device called an array. And through the machine, it circulates an alternating positive and negative current through the body, and by doing so it literally pulls toxins out through the pores of the feet. Over here we do Rife therapy medicine. Dr. Royal Rife was a medical researcher back in the early 30s, and he developed frequency medicine. So with the Rife therapy, through this attachment, and we have various attachments that'll connect into the Rife therapy unit, we use specific frequencies to help the body either stimulate function of an organ or devitalize an organism that might be affecting it. Room 5 is where we do our disc therapy. We have 2 disc therapy units. One for the cervical spine, if you have a compressed disc or a herniated disc in the neck. Over here we have for the low back discs. Low back discs, it can be anywhere from a frank herniation where the disc is bulged out, maybe pushing on the nerve, giving you sciatica down the leg, or it can just be a compressed disc. This is our AquaRoll technology. It was developed by a hand surgeon and it was put together to help reduce post-surgical scarring in his patients. The technology works, it's technically called circumferential percussive hydrotherapy. And what that means is that in here there are 30,000 of these little glass polymer beads. And they rotate around in a warm water solution and create a wave action. What it does is it tremendously increases the lymphatic movement in and out of that extremity, whether it's the hand or the foot, improves blood flow, blood circulation, reduces joint fixation, increases the joint mobility, and the nerve transmission dramatically improves, and conditions like carpal tunnel are dramatically improved through the AquaRoll technology. You can find information online at aquarollusa.com as well as our own website. We have nutrition rooms in 7 and 9 where we work with our nutrition patients. Now on the nutrition side of things, we're working with a broad spectrum of conditions. Things like thyroid conditions, hormonal imbalances, Crohn's disease, irritable bowel, a broad spectrum of conditions. And we work with them on a nutritional basis. We are designing clinically specific nutritional program for our patients. We use a wide variety, multiple lines of nutrients. So we look at lab work. We also use a technique called kinesiology. It's commonly called muscle reflex testing. This is one of our adjusting rooms in the clinic. In the clinic, we use both computerized chiropractic adjusting and we use the traditional manual adjusting. With the computerized adjusting, it's called the Pro Adjuster system, and there's a device that has a sensor in it here. As we scan down your spine, you'll hear those types of sounds. With that, we can use different size attachments and we can work on different size people. Now with the traditional manual adjusting, we use our drop table system. With the drop table, it often sounds a little bit startling at first with the patient. And when we take and we set the table when we do the adjusting will drop away, and it actually allows us to use less force and get the same amount of work done, because when the table bottoms out, you create a quick impulse that's faster than your muscles can respond, and the adjustment goes much easier with much less force. This is the X-ray room. There's a couple of things that I want my patients to know about the X-ray room. First is we use digital X-ray technology. This is a digital X-ray plate, and we only take pictures if necessary. The digital technology affords us the picture with much lower doses of X-ray. Over here, we have a digital arch scan. On our patients, we have the ability to measure a patient's arch and see, are their arches starting to drop? Essentially, are your feet flattening? So the digital arch scan is a method that we can, through technology, measure and see where your arches are. Again, I'm Dr. Mark Pederson. I'd like to thank you for taking the time to walk through this tour with me. If you'd like more information on any of the therapies that we went over, you can simply go to our website, optimalhealth.co, and you can see us on Facebook as well. We'll be posting regularly to keep you up to date. Thanks again.